So welcome everyone once again to our Legislative Café Chat series. This is our first series hosted by SolveME and the Long COVID Alliance jointly. So we're covering two really special pieces of legislation today that touch on both post-viral chronic illness broadly and specifically on long COVID or post-acute sequela of COVID-19 and some of the legislative solutions and policy solutions that are being discussed currently in the 117th Congress. For those who are not familiar with me, hello, it's wonderful to meet you. My name is Emily Taylor. I am the principal staff for the Long COVID Alliance, as well as the Director of Advocacy and Community Relations for the SolveME CFS initiative, also known as SolveME. I'm joined today by some really special partners of ours that some of you may know. We're joined by Elisa Daniel and Veronica Karam from, Elisa joins us from the Cornell Medicine Office of External Affairs as the Associate Director there for Federal Relations. And Veronica is the Senior Project Manager for Government Affairs at Houston Methodist Hospital System. So once again, thank you all for joining us. We're really excited and we look forward to your questions. So with that, I will dive right into HR 2754, the COVID-19 Long Haulers Act. This is jointly sponsored by Representatives Beyer and Bergman, so it is a bipartisan piece of legislation. Representative Beyer is a Democrat from the great state of Virginia, and Representative Bergman is a Republican from the great state of Michigan. So it's really great to see both a geographic and bipartisan effort leading this charge for this policy solution. The COVID-19 Long Haulers Act has three sections with three different policy proposals that are included and funded through the legislation. The first regards accelerating research through data harmonization. This is directed, the first section of the bill, directed at the Patient-Centered Outcomes Research Institute, or also known as PCORI. This section is funded at $30 million, and it includes conducting a survey of existing patient registries and then enabling PCORI to issue what we call RFAs, or requests for applications, or proposals for an open grant process that would fund the creation of a centralized data harmonization and patient registry system for long COVID and other post-infectious illnesses. SolveME, as you know, is a very big supporter, and we like to sing the song of the big data revolution. We believe we will find answers to these complex illnesses by collecting broad sets of data that compare longitudinally across multiple time points the progress and symptomology of these illnesses. So we think that, especially with the emergence and the urgent need to collect data on people with long COVID, that this policy solution will be really accelerate the field and move science forward, creating those large data sets that can be used to create big answers by churning all that information. And also, the second part of why we think this is a really important policy solution is that we have this important challenge of the different data streams. And as you know, we've struggled with this a lot in the myalgic encephalomyelitis, or ME/CFS space, because data is collected very differently. This also creates the opportunity to bridge that public-private divide, so that the data that's collected in the public sets and the data that's collected in the private sets can be cross-compared. Even if it's apples to oranges, we'll still be able to find some commonalities. And so no longer will the CDC, the NIH, the private research institutions like SolveME or the Stanford research team be working in isolation. These collective data sets will allow us to work together, bring all of these really helpful items together. So moving on, regarding the second item in the bill is the second provision. The second section focuses on medical education. This is the third bullet point, or this is the last bullet point on your slide there, the CDC public and medical education programs. This area is the most exciting part of the bill. It is also funded at $30 million, but it addresses that critical and crucial need that so many both long COVID patients and ME/CFS experience, the level of clinical understanding of this disease in the frontline medical providers. This has probably been the most common concern that I've heard from patients and providers alike, that there is a desperate need for appropriate medical education. A recent study in the UK found that over 89% of doctors currently practicing surveyed felt that they did not have the information or tools to adequately diagnose ME/CFS. 89% of providers. So that means 11% of providers out there may be providing correct diagnoses, which is not an appropriate medical education framework. So this $30 million to the CDC specifically funds both medical and public education about long COVID. And for this, I'd like to go to the next slide to demonstrate a little bit more of the specifics of that area. Jesse, could you advance the slide, please? Thank you so much. So for this section, I would direct you to the two boxes on the right. So you can see there's 4 boxes total, the 2 on the right-hand side of your screen. You'll see that these 2 specifically itemize the areas of medical education that the bill specifies. I've highlighted some of the interesting components of the bill here so that we can demonstrate exactly what kind of language the agencies would be receiving. And as you can see in the box on the bottom right corner, myalgic encephalomyelitis, or ME/CFS, fibromyalgia, FM, post-orthostatic tachycardia syndrome, or POTS, and other forms of dysautonomia are specifically called out as areas of education, because these are areas that have both been identified as A, overlapping with long COVID significantly, B, having very poor medical understanding in the baseline care that people receive, and C, are generally illnesses that the public doesn't know to ask about either. So that even though the medical care providers are not providing the information, the public can also provide that information, and unfortunately most people are not aware of that. So this medical education program, as you can see, really specifies and drills into these areas, and we're very proud of that piece of that area of the bill, especially as meeting that urgent need for medical and public awareness. If you could go back to the next slide, please, Jesse, or the first slide. The last area I'd like to highlight is the area of the last section of the bill, which has to deal with disparities research and barriers to care. This section is also $30 million. You can see a theme here. And that area focuses on AHRQ, the Agency for Healthcare Research and Quality. This agency, the AHRQ, also known as ARC, is responsible for exactly as its name implies, looking at healthcare delivery, looking at the quality of healthcare and treatments out there, and making policy recommendations and identifying areas in which those are falling short. So the AHRQ, also funded at $30 million by this piece of legislation, would then be able to conduct a detailed evaluation and another survey about long COVID patients and the service delivery they're receiving. And the purpose of this study is to identify what barriers are preventing care, what disparities are preventing care, and make recommendations to the agencies for eliminating those barriers and disparities. This is really targeted especially towards healthcare delivery, towards underserved communities, communities of color, geographic barriers, to try to identify where, why, and how some people are getting care and some people are not getting care, and how we can make recommendations to the agencies to get rid of those barriers and equalize the playing field for everyone.